Thank you for checking out Dr. Christine Greves' website. I'm sitting down with her today to talk about all of your most important questions about the female body. So let's dive right in. Dr. Greaves, something that a lot of women are curious about is birth control. There's so many options out there. So how do I know which one is the best one for me? I want to make sure that I'm picking the best one that meets my needs and my goals. Can you tell me about the different options?
Did you know that half of pregnancies are not intended? Half of them are unplanned. So to help you with that, I'd like to talk about birth control options, also known as contraception. The ways that you can prevent it are kind of divided up into reversible or irreversible, meaning are you completely done with your option of having children. If you don't want to have children in the future, you could consider the irreversible. But if you're not committed to that, if you're not completely sure, then go with the reversible. And under the reversible, you can either do a daily type of thing, like a birth control pill or something, or you could consider something longer acting. So we can go into all of those topics. That's how this video is going to be. Irreversible is a simple, easy topic because there aren't that many options. You, a woman, would get sterilized, meaning I'm sure you've heard of your tubes being tied or tubes being burned. That's an option, and that's a surgical procedure. The other option is your partner could get a vasectomy, to where he would not be able to have children as well. And he could see his doctor for that. So that's the irreversible if you're sure you never want children again. But if you're not completely sure, don't do it because the ability to reverse that irreversible type of procedures, pretty hard. I wouldn't even consider that as an option. Now, let's go into long-acting versus short-acting. Let's say you're younger, you want to go through school, or let's say you just had a kid, you don't want to have another one for a while, or let's just say whatever it is, you can't remember to take a pill daily, or you can't remember to do certain things that require more diligence on a daily basis. That's okay. Then you may want to consider the long-acting reversible birth controls. The long-acting reversible birth control is like an intrauterine device, for example, the little IUD you may have heard of. Your mom may have mentioned it as something like a little T that goes inside of your uterus. The other option is a little rod that can go in your arm that's progesterone, and then that can work for 3 years at preventing a pregnancy. They all have side effects. They all could be difficult to remove. They all have risk with the insertion. But those risks that they carry are less than the risk of you getting pregnant. So it's something to consider. So you could go see your doctor about that. Then there is the option of something that's shorter acting, meaning it's not long acting. So let's say you're thinking, I want to have a baby in 3 or 4 months, or at least start trying. That's when I would not recommend the long acting for you. I'd recommend the short acting. And you can do that by hormones or not using hormones. The not using hormones, meaning the non-hormonal method, could either use a barrier form, like a condom. There's also a diaphragm, but that does not work as well. There are the pregnancy apps, the birth control apps that I wouldn't use unless you're okay with getting pregnant sooner than you desire. Then there is the hormonal side, and that you have to make sure that you don't have any contraindications to that, like if you've had a stroke or a blood clot, or you smoke, you're over the age of 35, and you smoke, or you're over the age of 35 and you have migraines. Then you're a little more limited on the options of birth control, but I'll just go into the hormonal option for you. You can either take a pill, that's something that's very commonly given, and that pill can either have 2 hormones in there, estrogen and progesterone, or it can have just progesterone. And you do need to take the pill roughly about the same time each day, and you can therefore hopefully prevent a pregnancy. The failure rate on that is about 1%. If you can't remember to take a pill every day roughly the same time, there's a little ring that can go inside the vagina that stays in there for 3 weeks, and that can also help prevent pregnancy, or a little patch that can go on your skin, and that you would change every week. All of those have similar mechanisms. It's just, how is that medicine delivered? How are those hormones delivered to your body to help prevent you from ovulating and from the ability to have a child? Then there is the option of something longer acting. Like, let's say it's hard to remember to take a pill every day. You just want a shot every 12 weeks, and then you're good. So that's when you can get a progesterone shot. It's been known as medroxyprogesterone, or the Depo Provera shot, and that's when you can get that every 12 weeks. Yes, there are certain side effects. Some can see some weight gain with that, but if that's right for you, then that's an option. And those are the choices that you have, so you're not part of that 50% of unintended pregnancies.